Patients can have multiple different kinds of wounds, and often the blood flow behind the wound is part of the problem. Arteries are blood vessels that take blood from the heart to the tissues. Veins are blood vessels that take blood back to the heart. When people have wounds caused by venous problems, generally it's because their veins are not working correctly and they're allowing blood to flow backwards back towards the feet and ankles. This sets up a situation where blood products can actually set up camp in the soft tissues and fat in the feet and ankles and lead to inflammation and fibrosis. Over time, the skin in that area can become almost leathery like a football, and eventually it can crack open. Once this happens, you're set up for an ulceration, which is a superficial wound that becomes very difficult to heal. Often it can take months to heal and sometimes years for some patients. Generally, wound care for these issues involves not only local wound care, but compression wraps that patients have to wear for days at a time. It can be quite a problem, and so our goal is to help patients avoid getting into this situation. Other patients that we deal with may have wounds that are from arterial insufficiency or poor blood flow into the feet and ankles. When that happens, they'll often have punctate little wounds, not like large ulcerations, but smaller punched out areas. These areas generally are very difficult to heal because the patient just does not have good enough blood flow to get the nutrients, oxygen, and other things to the wound that are needed to heal. Generally, if this occurs, we have to go in and do some sort of arterial stent or arterial bypass to increase the blood flow to the area so that the wounds can heal.